So what are floaters? Floaters are these black squiggly things that you see sometimes in your field of vision. They float around. When your eye moves, they move around. So your eye is filled with a gel. This gel is called the vitreous humor. And as the gel ages, like with any other part of your body, the aging change in the gel is that it may start liquefying in certain areas or pockets. Sometimes it may separate from the retina, and any shadow, anything in the gel, you're going to see an image of that, especially against a white wall or in very bright sunlight. So it could just be an aging change in the vitreous humor. Rarely it could be if there are white blood cells or red blood cells or any kind of debris in this gel. If there's a small bleed or there's inflammation, ya sujan inside the gel, again you may see floaters. So you need to go in for an eye checkup to ensure that your retina is healthy. Floaters per se are not always an eye disease or do not always have treatment. But with neuroadaptation, your brain has this capacity that these tiny small floaters you learn to ignore because they're always going to persist. As I said, it's an aging change and you learn to ignore them and you stop seeing them at some point. Rarely, occasionally, you may find one or two, but suddenly if you see too many of them, go for an eye checkup.